Thank you very much. As a champion of Bantry General Hospital, I would like this all to know that last Wednesday there was no laboratory service available, and as a result, hundreds of tests were either cancelled or not processed. When you factor in that the laboratory services was also withdrawn from Cork University Hospital, the Mercy Hospital, and the South Infirmary, the number of affected patients in our constituency likely numbered in their hundreds, Minister, from just one day. I have had many emails on this issue. One from a medical scientist in the cytology laboratory in Cork University Hospital. She has worked in CUH for 17 years, Minister. Herself and her colleagues are regrettably on strike this week because of a long-standing pay dispute. Biochemists in the public laboratories do the same work as biomedical scientists, yet they are paid 8% more. Two colleagues basically working side by side, one is paid more. This was addressed 20 years ago and agreed upon, but was rescinded very shortly after. Laboratories across the country are at breaking point. They absorbed all the extra work generated by COVID with absolutely no extra staffing or resources. COVID labs were set up overnight, which took staff from all disciplines to cope with the emergency. The labs are not just about blood tests, they do vital work across blood science, cancer care, attendances at bronchoscopy, fine needles and rapid access clinics, head and neck clinics and everything in between. Even if pay parity is addressed, we are still left with a huge shortage of graduates. They do their in-service training and run to the private sector. I don't blame them. Their work conditions are so stressful. They are all asking the same. They don't want us standing here in the Dáil clapping, but instead engage in meaningful talks with them and their unions. The Minister for Health, the Minister for Public Expenditure and their department heads need to know now get into a room with the union as soon as possible. With this plus 20-year farce has to end now, Minister.